Well, good afternoon, and welcome to a special meeting of the Board of Education for Greeley Evans School District 6. Today is August 27th, 2021. This meeting will now come to order. Will you please join us for the Pledge of Allegiance to our flag? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Ms. Crane, will you call the roll for us, please?
Mr. Haefele?
Present.
Mrs. Mash?
Present.
Mr. Matthews?
Present.
Mrs. Mueller?
Present.
Ms. Pappas?
Present.
Mrs. Solis?
Present.
Mr. Talley?
Present.
7 members present.
Thank you, Ms. Crane. Our first item of business is to convene an executive session, and we will need a motion from a board member to do so.
I move that the Board of Education of Greeley Evans School District 6 proceeds into executive session pursuant to CRS 24-6-4024B for the purpose of conferring with the attorneys for the board to receive advice on specific legal questions concerning compliance with governmental and health agency guidance regarding safe schools.
Second.
Thank you both. We will now convene to executive session.
Do we have to take a vote?
Oh, sorry. We do need to take a vote. Always forget that part. All right, Ms. Crane, will you give us a vote, please?
Mr. Haefele?
Aye.
Mrs. Mash?
Aye.
Mr. Matthews?
Aye.
Mrs. Mueller?
Aye.
Ms. Pappas?
Aye.
Mrs. Solis?
Aye.
Mr. Talley?
Aye.
Motion carries 7-0.
Thank you, Ms. Crane. We will now go into executive session. Well, welcome back to our Board of Education meeting, special Board of Education meeting on the 27th of August. We're going to continue with our meeting. We have convened an executive session to receive legal counsel and are now done with that portion of our meeting. And we're on to the next portion of our meeting, which is to discuss COVID protocols for students, staff, and visitors. And we will need a motion to proceed.
I move that the Board of Education of Greeley Evans School District 6 requires that masks must be worn by all students, staff, and visitors indoors with students at all District 6 schools in grades preschool through 8th. The mask requirement shall become effective on Monday, August 30th, 2021. This requirement will terminate upon a majority vote of the Board of Education unless superseded or amended in writing, or as otherwise directed by the Weld County Department of Health and Environment, the Colorado Department of Public Health and Environment, Center for Disease Control, or any other public health agency authorized to enforce certain rules and regulations for school districts related to matters of public health.
Second.
Thank you both. Before we begin our discussion, Dr. Pilch, I know you've given us a lot of information to look at. Is there anything else you would like to say before we continue?
Thank you, President Matthews. As you indicated, you have had an opportunity to confer with legal counsel. I've provided you with the data that you all have asked for around positive cases and quarantines and the recommendations and information that we've received from health officials, and I'm happy to take any questions you might have.
Thank you, Dr. Pilch. Are there any comments or questions from board members?
Do you want us to use our light or just...
Yeah, I think we're good to use your buttons again.
Okay, I don't have one, so I don't know how to... I'll just tell you.
Ms. Pappas, are you
Yes.
wanting to speak?
Yeah, I do have a question. So, Dr. Pilch, you did provide us with a lot of information, valuable information about guidelines, requirements, data. I am wondering if you have been in contact and received advice from Weld County health officials?
So I have worked with the same officials I've worked with throughout this pandemic, officials from our largest healthcare providers in the community, as well as I continue to meet weekly with the Weld County Health Department team. So we have had an opportunity to hear from them, and as recently as this week.
Thank you.
Ms. Solis?
I don't have a question, but I would like to make an amendment to the motion to change preschool through 8th to read preschool through 12th.
Is there a second for the motion to amend our original motion from K-8 to essentially K-12?
Second.
There's a second. So now we will be discussing the amended motion and the amended motion, or the amendment to the motion, which would be to amend the original motion from K-8 to K-12. Mr. Havely.
Because high school students have the ability to have the vaccine, I'm very uncomfortable with that, and I prefer the first motion, the K through 8.
Ms. Mueller.
I would like to know, Dr. Pilch, what is the sense among our high school administrators on this possibility of masking all the way to K-12? What is the will of the high school principals?
So I'm looking at Mr. Osmus, our Assistant Superintendent of Secondary. My understanding with the last check-in with high school principals was at this time, they feel like they are doing a good job of managing at their buildings, and it is my impression they would not recommend that we require masks at the high schools at this time. However, they understand that if at any point they reach that threshold that we have set of 2% of positive cases of their total population at any given time, that at that point we would be moving them to be fully masked for a period of 28 days, as we have done at a few of our district sites. We are around 45% total vaccinated high school students. Our high school staffs are actually our highest number of vaccinated staffs in the district at 75%.
Okay, thank you.
Can I ask a question about
Yes,
that?
ma'am.
So knowing that information is helpful, I am also wondering though, do we have opportunities for our high school students to get vaccinated? I know that was one of our goals before. I'm just curious about that opportunity for them to get vaccinated.
Yeah, thank you, Ms. Pappas, for that question. We do have 2 opportunities coming up on our high school campuses. I mean, of course, there's opportunity throughout the community with the vaccine so widely available, but with the COVID-19 vaccine bus, we just scheduled 2 vaccine clinics, one at Northridge High School in the parking lot with the COVID bus on September 9th from 1 to 8 p.m. and one at Central High School on September 16th from 1 to 8 p.m. It of course does require parent permission unless the student is 18 years of age, and the parent does need to be present at time of vaccine, is my understanding.
Thank you.
Ms. Solis?
So a couple questions. What about professionals that go back and forth, for example, like speech therapists, and they go from like school to school if it was just K-8? And then my other question is, what about families that have mixed high school and middle school and elementary kids? Are you hearing anything from medical people?
So when we talk with the medical professionals in the communities, of course, their druthers are to have everybody masked indoors all the time. And I just want to be honest about that. And they also understand how complex this is, and they understand the divisiveness that this issue has caused in our community, and are appreciative of the importance of keeping learning in person, and at the same time, everybody feeling like they can send their children to school, and that staff members feel like that they can be in school. So I think that was part of your question. Another part of your question I think you're asking is, so if I'm a staff member and I work across multiple buildings, what would be the expectation for me? So the way the motion is stated right now, it is in those buildings. So a staff member working in a pre-K-8 would be required to wear a mask when they are in that pre-K-8 if this motion passes tonight, whereas they would not be required to do that when they're in other district facilities that are not preschool through 8th grade facilities. And that, I think, as we've watched other districts who have gone to the preschool through 8th grade, and as we do work with health officials, it's really about protecting those children who are 11 and under, and that's why we would actually have even maybe some students who are 13 or 14 in a middle school still mask, and the staff in those buildings who are vaccinated still mask, would be, if I understand your motion, would be to protect those 11-year-olds that they are in the building with.
And
11 and under.
under right now with the policy that we have in place, do we have any way of knowing specifically who's vaccinated, who's not vaccinated, who should be wearing masks, who shouldn't? And is there any, I know it's voluntary as far as testing, but there's no mandate for testing for people who are unvaccinated within the district right now.
We have asked staff to share with us their vaccination status if they're willing to do that. And most staff have shared with us whether they are or not, or choose to not share the vaccination status. We are not tracking that and enforcing mask wearing in relation to vaccination status. We use that information to know, like what I just shared with you all, that 75% of our high school staff report being fully vaccinated. And we use that information when there is a known exposure and we should have to quarantine, then we identify as the staff member who was exposed, are they vaccinated? And if they are vaccinated, they don't have to quarantine. If they're not vaccinated, then we ask the question, are they wearing a mask?
And I know that you just told us about the percentage of staff that's vaccinated. And I was wondering if there's any, I know we're looking at COVID rates. But I had two questions. One, are you getting information about our pediatric beds in our medical facilities? And two, are you paying attention to also vaccination percentages as far as our community?
Yes. Yes to both. The first is to say to you that in talking with hospital officials this week, there is a shortage of pediatric beds, primarily due to just a high volume of pediatric patients in the hospitals right now. There is multiple strands of respiratory illness right now that are not necessarily COVID or COVID related that the hospitals are seeing. That was shared with me. They're also seeing things like suicide attempt and drug overdose among their pediatric beds, and that was shared with me.
So as
Is there
far as
another party?
oh, go
I
ahead.
think I missed.
The vaccination percentages.
Yeah, we are watching the vaccination rates. Because when a child is vaccinated, when any of us are vaccinated, that information goes into a state system. School districts are provided with the vaccination status of the students in their district. It's kept confidential just through our health services. So we do have vaccination rates related to our students, and we receive that every 2 weeks. And then the vaccination rate on staff is self-reported. There is no system in which that would be shared with us if the staff member does not choose to share it with us.
Okay. And you are aware that the Latino vaccination rate for zip code 80634 is at 32.1%, 80631 is at 27.9%, and 80620 is at 33.3%?
Correct.
Okay. And our district is how much percentage would you say we have Latino kids and families part of our community?
Well, at least 60%.
Okay.
Mr. Talley.
So Dr. Pilch, first of all, I'm sorry that this has to come up now, and it's tough. And I think all of us up here would agree that this isn't only about putting masks on our children. None of us want to do that. None of us think it's comfortable. What we want to do is make sure that our students are in school. We want to make sure that they have that access and that face-to-face and that socialization. Do you have the data or any numbers for us around what has attendance looked like in terms of since from the beginning of the year with students being out sick?
So we are not seeing a significant difference in attendance than we typically would. Now, keep in mind, we were in COVID a year ago. So, attendance looks far better now than it did a year ago, because a year ago we were quarantining a far greater number of students because we quarantined everyone who was exposed. Now, if you are exposed and you're wearing a mask, you don't have to quarantine, and we aren't quarantining entire classrooms. We are only quarantining direct exposures within 3 feet for more than 15 minutes. So, but you all have seen the numbers. We have nearly 1,000 students out right now who are either in quarantine or who are positive with COVID.
And maybe you might have said this and I might have missed it. What does the quarantining policy or procedures look like if students are in masks?
If everyone is wearing a mask and they're wearing masks properly the entire time, there is no need to quarantine. The exception.
Good. Yes, can we please have everyone be silent? Thank you.
So I'll restate that, Mr. Talley. If everyone is masked and there is a direct exposure, someone in that table group or in that activity is positive for COVID, and everyone has been masked, there is not a need to quarantine.
And that includes the individual that is positive?
No, the individual who's positive has to isolate.
Okay.
At that point. So they're required by the health department to isolate for the period of time since symptom onset and then to return to school.
Okay.
That's my button.
Ms. Pappas.
I'm so sorry. So Dr. Pilch, one of the the concerns you just mentioned is the number of kids that are out because of quarantines, and that has a tremendous impact on our families. And we do have a lot of families that need to work every day. We don't have the opportunity to do remote learning with our children, so that's a huge concern for me. With high school, I know that the high school principals are doing also contact tracing, which is also adding an additional burden to them, but it sounds like they are making that work. And the kids that are, the high school kids that are quarantined, are they able to attend the class through synchronous learning, or what education are they getting when they are quarantined?
Yes, our high school students are attending through synchronous learning if they are quarantined.
Okay, thank you.
I think Ms. Solis is next.
And so we do have some classes, like I'm thinking preschool, where the whole class has been quarantined.
Yes. With the littles, the preschoolers, we really can't do the targeted quarantining within the 3 feet of distance. So, if the individual who was positive was in that classroom for more than 15 minutes at preschool level, we do have to do the full quarantine because they're all over the classroom.
And I know when we talked last year and even discussion for this year, one of our biggest goals was to have kids in-person learning. And the last meeting that we had, we kind of talked about the bus situation and some of our bus drivers that had gotten COVID and how many bus drivers we were down. And how many kids is that impacting right now? Are they able to come to school? Are they here on time? Are they being able to be part of school?
I don't have that number, Ms. Solis. What I do know is that children are coming to school and we are not being told children are staying out because of transportation. I'm looking to the team. People are so when a bus driver is absent, we still run the bus, but the bus may be later, or the bus may have to take 2 loops, but we're still running our routes. We're not just canceling transportation for families. It's just not as good as it should be.
And then my next question, obviously there's layered protocols to really help with COVID. One is masks, the other is making sure people are tested if they're not vaccinated, and then the other one would be vaccination. We've seen lots of different school districts doing different things. Some are starting to mandate the vaccine, some are starting to mandate testing. Which is the least invasive that we could possibly do when it comes to the layer approach, those three things?
I can't answer that for you.
Okay.
Ms. Mueller. We can, we'll need everyone to be silent, please.
This is democracy. It's our kids. Our kids. We pay your taxes. Equity.
Question is, last year, as I recall, when we often had to go to remote, it was due to actually staff deficits at the different buildings. Do we have any of those staff quarantines that are causing some teaching absences that are starting to impact our schools?
Staff quarantines are relatively low. The one exception would be at Union Colony Elementary, where they are fully remote, and went fully remote this past Monday due to staff absences. Due to staff being either positive or quarantined.
Okay, thank you.
Right now, we have, of district staff, we have 11 district staff quarantined right now, today.
Ms. Solis.
So we've had a lot of people come to our board meetings and talk about rights and you know, they're very passionate and we have heard you. So I was concerned because I have not experienced a pandemic in my lifetime. And so I wasn't sure what that looks like. So I was doing some research and there is actually a previous case. It was in Jacobson versus Massachusetts, and the Supreme Court considered a challenge to the state law requiring everyone to be vaccinated against smallpox. Henning Jacobson refused the vaccination and was convicted. The court upheld the law and Jacobson's conviction. The Constitution, Justice John Marshall wrote, for a 7-2 majority, does not import an absolute right in each person to be at all times and in all circumstances wholly freed from restraint. Instead, a community has the right to protect itself against an epidemic. Its members, many at times under the pressure of great dangers, be subjected to such restraint to be enforced by reasonable regulations and the safety of the general public may demand. I know that we are elected officials, and as elected officials, it is our job and our duty to make policy for District 6 students. Is that correct?
Yes, it's your role.
I also got information from a local physician who talked about what was happening in a lot of our medical facilities, and extraordinarily tragic and unfair when this wave could have been prevented. Health systems moving to crisis standards of care means people will not get the same level of care they would have had if the Delta COVID infection had been prevented. We in the community are the first line of defense in stopping this horrible, deadly pandemic, and all must do our part. Choosing not to participate in prevention efforts is hostile and abusive to exhausted and traumatized healthcare workers. It's time for community leaders and elected officials to step up prevention efforts across this nation. Let's not be complicit in further crashing the healthcare system by promoting messaging that minimizes the seriousness of this infection in the unvaccinated and turning our backs on our healthcare workers who can't save so many lives that have to witness all these deaths. Only thanking or praying for healthcare workers is really disingenuous at this point. More Americans have died from COVID than died during World War II. Let's all do our part. Put on a mask, distance yourself, sanitize your hands, get vaccinated. Please don't sit in the stands and watch us lose more and more lives. Get in the game as part of a strong offense and be the hometown community defenders of healthcare workers, friends, and family. Thank you in advance for all joining the team and playing a part on offense. Our defensive players in healthcare appreciate your genuine, coordinated assistance in winning against this Delta strain. We can do it together if we all pitch in. I just wanted to read that as another reason why I made the motion and why I'll be voting for that motion. The Delta variant is very different than what we dealt with in COVID last year. And we do have a responsibility to each other as community members, as some do not have the choice to get vaccinated because they're not age eligible. And we have people with medical conditions where they are not able to get the vaccine. This is what we can do for one another. This is what we can do for our district family. This is what we can do for students. And I struggle because I feel as though this is a moment where our kids can learn a valuable lesson. Not only is it your right to stand up and say what your opinion is, but also that we have some large problems to tackle as communities. And if we work together, we can do that. And it is our responsibility to work together to solve problems. The reason we're here now is because we didn't do what we were supposed to do last year. And if we don't do what we need to do now, we're gonna be here again next year. I wanna thank community members for being here. I think this has been a struggle for all of us. I wanna thank my fellow board members. And again, I will be voting to support K through 12.
Ms. Pappas.
I would like to take us back to the high school issue, Dr. Pilch. So let me just clarify that if this, if it's not K-12 and it's a pre-K-8, the marker that is used to determine schools being required to wear a mask would be the 2% that we have been using already. And that we would, I'm wondering if we would be all of the high schools, are we doing that on a site-by-site? Because those high schools are very different. But I'm just curious about what the next steps would be.
So the 2% indicator has been used site by site. And so it will be, we're looking at numbers every day, multiple times a day, at each of our sites. And so if we were to hit that, at an individual site at a given time, then we would move to masks for the 28 days.
Thank you.
Is there any other discussion on the amendment? Mr. Hafley?
I want to make sure the amendment is moving it from K-8 to K-12. Am I correct? That's what we're voting on.
That is correct. So an aye vote on this would change the original motion from K-8 to K-12. A no vote on this will leave the original motion as it is, and we will continue discussion on the original motion.
Okay, thank you.
You're welcome, sir.
To clarify, the original motion begins with preschool.
Preschool, sorry.
Yes.
Yeah. Any other questions? Any other discussion on the amendment? Okay. Ms. Crane, will you give us a vote, please?
Mr. Hafley?
Opposed.
Mrs. Mash?
Opposed.
Mr. Matthews?
Opposed?
Mrs. Mueller?
Opposed?
Ms. Pappas?
Aye.
Mrs. Solis?
Aye.
Mr. Talley?
Opposed.
Motion fails 2-5.
We will now continue discussion on the original motion that we read originally, and that is pre-K, pre-K 8. So are there any other comments, questions around the original motion? Mr. Talley?
Dr. Pilch, if no masks are implemented, could you run us through what are the precautions that are in place that will continue to be in place?
Yes, so presently, a lot of contact tracing is taking place. Not a lot, I mean, every case is being contact traced, which is an important piece of stopping the spread. And then we are enacting the close contact quarantine guidance from CDPHE and CDE. We continue to sanitize and disinfect. We have replaced all of the air filtration systems in our classrooms, or the filters in those new air filtration systems we purchased last year. We are also getting outdoors as much as we can, and getting as outdoors to eat whenever possible with our students, because we know during that eating time is the time that the virus can be particularly contagious. We're also strongly recommending social distancing. I mean, that has proven to be very difficult. I mean, children want to be together, and that piece is still very difficult, but I think people understand how important that piece is. We've asked families to take temperatures in the morning prior to sending children to school, and then we continue to educate families and ask families to please keep their children home if the child is sick, or if someone in the home is being tested for COVID, or has been exposed to COVID and is waiting, to please keep your children home during that time. We also will have the ability we currently have the rapid tests at all of our school sites for staff to utilize, and for families to utilize if they choose to do that. We will be a part, I was notified today that we've been fully approved to be a part of the state serial testing program. So families and staff may choose to opt into serial testing, which means they will they may be tested every week there at the district site through a state testing program.
And for the people viewing or around, could you how long does this mandate? Is there a time limit on it, or how do we revisit it?
Well, the way your motion reads is it is in place until the board takes action to change it, or until there is a public health order or directive from a public health agency that changes it. So if new guidance would come from the Colorado Department of Public Health and Environment, or not guidance, a requirement or order, or from the governor's office, or from our local health department, then that would change this guidance.
Thank you. And, you know, this isn't a question, but I'll just say I find it extremely, extremely unfair that a school board is the ones that have to make this decision. We have elected officials higher than us that are paid and have professionals that can interpret data. And they are pushing it down to us. And I appreciate everyone and how passionate everyone is, but we have to understand that regardless of our decisions, 50% of the population is going to be pissed off at us. And there is no winning in this situation. But I just want everyone to know that the best interest is really the children and keeping them in the schools. And I do believe that we have to do what we can to ensure that our students are in buildings and that our students are safe. And regardless of people's opinions, we have to truly consider that. And that's kind of where I stand with that. And I'm sorry I'm talking. And this is a hard decision. And I'm sorry there's no winning, and I'm sorry to everyone who's going to be upset with whatever decision that we make. But just know that this is a decision that is unfair, in my opinion. And our leadership in the state should be making these calls, and it shouldn't be us as a school board.
To be silent. Guys, thank you. Ms. Solis.
So I'm disappointed that the amended motion didn't pass. I do believe that CDPHE is in the process of looking at stricter guidelines, and we will be facing that. I do appreciate that the first motion is on the table, and I will be supporting it.
Thank you, Ms. Solis. Mr. Hafley.
First of all, I'd like to thank Dr. Pilch. You know, since her arrival, it's been about the whole child. It's the social, emotional, the educational, and the safety component, working with the communities of Greeley. And during the course of time, it doesn't matter if it's the bond issue, the MLO, graduation rates, dropout rates becoming less. We continually improve. And during this whole thing, starting the 12th of March in 2020, Dr. Pilch has worked harder than anybody in this room, probably everybody in this room combined on this. And it's always been about the welfare of our students and your children. And consequently, I'm very, very appreciative of the things that she's done in her leadership role. The Board of Education is here to educate as well as keep your students safe. The enormity of this decision, you don't understand. You're thinking about 3 or 4 people in your family. We're thinking about 25,000. So I appreciate that you have passion, but what you need to understand is we're responsible for 25,000 in 2 communities. To our, excuse me, please. To our educators, I want to say thank you, because the last 18 months has been absolutely horrific. And I know that this decision is going to make it harder for them, because people in this room are too selfish to make up and to help other people in this community.
You have the right to educate, not medicate.
And excuse me, I have a friend who's a cardiothoracic surgeon. And this person, I had a long conversation with him on Wednesday night. And he said that any opportunity to help somebody be healthy is important. His granddaughter, who's 4, wears her mask to preschool daily. My daughter, who's the ICU nurse at the Mayo Clinic, has talked about masks don't create illness. As I look at the people in Greeley, I've grown up here, my parents were born here, I was born here, they died here, I'll die here. I've known Greeley as a great place. And I've always looked to everybody in this community to rally together. And I will vote for the amendment that's on the table. Motion, excuse me.
Ms. Mueller.
So, one of the things that I have heard continuously throughout the community, including many organizations that support the school district, is that the utmost priority is to keep kids learning face-to-face in school. Having myself taught online, I will tell you how very difficult it is to do and to engage students online, and we heard that continuously last year. And I do feel for our teachers and our educators, and I know how difficult it is to continue to do that in and out movement of face-to-face learning to remote learning when quarantines were necessary and when we ended up having to move completely online in the face of outbreaks. So we have really only a couple of choices when we are faced with outbreaks and when we are faced with quarantining. And that does involve the mitigation strategies and the layered mitigation strategies that Governor Polis's office, the CDPHE, the CDC, and the Academy of Pediatric Physicians has recommended. Therefore, I feel that the only option is to select another layer of mitigation strategy and providing masks to our K-8 students in order to ensure that we can keep them in schools for face-to-face learning. If we do not do this, we may have cases rise, we may have quarantines rise, we will have hospitalizations rise, and we may actually have children die. And I am loath. The fact of the matter is people have died from COVID. So to laugh about that is insulting. People have died.
Guys, can we please
Therefore, I am loath to consider the possibility that we face children being hospitalized and being injured and facing death. I am not willing to consider we could have done something more and not have chosen that path. Therefore, I want to remind the community that we had said in previous board meetings that if conditions changed and the environment changed, that we would have to change our decisions and our stance on this. And I will support the current motion.
Thank you, Ms. Mueller. Ms. Mash.
I just echo that last part that we have said from the beginning that we would make decisions based on the situation at the time. I appreciate the innovative ways of, mask maybe just one school, mask a cohort, things like that as the situation has increased. And so at this point with the numbers that even just from our board meeting on Monday to Wednesday when the article came out in the paper that it increased from 137 cases to over 200 cases. These are the reasons that I feel that something needs, further more stringent in protecting needs to happen. And so for the K-8 population that cannot be vaccinated, I support this motion as well.
Thank you, Ms. Mash. Ms. Pappas.
Thank you. For the same reasons I stated when we started school that we would revisit this when things were, cases were increasing, quarantines. I really believe that the targeted quarantines would work. I believe that people would wear masks, but now it is evident that we are in a case where we are seeing so many quarantines that our families are impacted. And I wish we would do the PK-12, but I am absolutely going to support the PK-8, and I am going to hope that we can be compliant and hope that we can get this pandemic and COVID under control. I will be supporting this motion.
Thank you, Ms. Mappus. Any other questions or comments from board members? It's been a long 18 months. And we do appreciate that you've been here today, and we appreciate all those who've reached out to us via email, and though many of you have see a lot of familiar faces in the audience, and many of you have come and spoken before at our board meeting. So, and I appreciate how respectful you've been. But it's been a long 18 months of doing this, and I know we're all tired. We're all tired of the masks. We're all tired of the quarantines. We're all tired of the cohorts. We're all tired of Zoom and terms that we never thought that we would know, like remote learning. And we're tired of worrying about our grandparents and our parents, and we're tired of worrying about our kids and if they'll be able to stay in school. And we're tired of worrying about our businesses, and we're all tired of it. But the fact is, it hasn't gone away. And this week we began to see numbers rise dramatically in this community. As Ms. Mash said, we've seen them rise in our schools dramatically. And we need to, we know that every day without a mask is better than a day in a mask. We know that. But we also know that we have to protect and do everything we can to protect our students right now. And this is something we can do to protect our students and to keep them in school. And so I too will be voting for the motion. Ms. Crane, will you give us a roll call vote, please?
Mr. Hafley?
Aye.
Mrs. Mash?
Aye.
Mr. Matthews?
Aye.
Mrs. Mueller?
Aye.
Ms. Pappas?
Aye.
Mrs. Solis?
Aye.
Mr. Talley?
Aye.
Motion carries 7-0.
Thank you, Ms. Crane. Please, thank you. That is all the business that we have for today at this special meeting. This meeting is now adjourned.